Okay, this is an educational video on joint capsule damage in the finger of a rock climber. This typically happens on pockets. So if we look at this picture here, when athletes are grabbing monos or two-finger pockets, and the hand is more of in an open position, so not as much in a full crimp or a half crimp, but the open position when grabbing on pockets, usually quite a bit of force down and then a lot of torque and twisting with an audible pop. So in order to damage the capsule, there typically has an injury to the bone. The ligaments will pull the bone away from the bone, and it almost always accompanies an audible pop. So the mechanism by which these kinds of injuries happen, it's a strain and rupture of the capsule and or the collateral ligaments, which are kind of the same thing. On the sides of the joint is a capsule, but on the outside are the collateral ligaments, which are thick extensions of the capsule, creating more stability to the joint. On the back side, there's also a tendon that lives there and a capsule. And on the flexor side, there's also a ligament that's on top of the capsule. So the ligaments that go around the joint are essentially designed to stabilize the joint, but they are extensions of the capsule. So you can't really damage the capsule without damaging one of those tissues. Volar plate is also an injury that happens when the finger is in hyperextension. So if I'm grabbing onto a pocket with my middle finger and my middle finger is open and I'm grabbing and twisting in like a static kind of move and pull really hard, I can get damage to the collateral ligaments on the side. If I'm in a pocket and like on a kilter board problem and I hit something open-handed and my fingers go into extension, I can put a lot of strain on the volar plate, which is on the flexor side. So both of those would be considered capsular injuries. I see way more commonly injuries to the collateral ligaments and stress fractures to the sides of the bone more than I do on the volar plate. The volar plate injuries that I have seen from a climber happen from falling with their hand opened, or one person in particular fell into a river, just crossing the river, and hyperextended their finger. So the volar plate is going to be less common than the collateral ligament ruptures in this case. Diagnosis: if you are grabbing onto a pocket, twisting and you hear a pop, you need to get an x-ray. So definitely want to get an x-ray. So before booking a consultation with me, go in and get an x-ray. If you can't get an x-ray because you need an order, then schedule with me and I will write the order from a distance and you can go in to get an x-ray. We can do an ultrasound if the x-ray is not conclusive. A lot of times the x-ray will be negative and we'll need to use a diagnostic ultrasound to document how much of a sprain we have to the collateral ligaments or how much of a sprain we have to the volar plate. Orthopedic examination is we want to do lateral stress testing. So when your finger is straight, you're going to want to bend the finger to the side in both directions and measure that on the opposite finger. See if there's more joint play, see if there's clicking, see the kinds of symptoms that you get from that. And then you also want to bend the finger to 20 degrees and do the same thing. Try and relax and stress the joint. See if there's any pain, any extra motion. Prior to meeting that helps us get a better understanding of the potential injury of what's going on. If you have one of these injuries and there's an audible pop and you wait a few weeks before you watch this video and your joint won't flex and won't go into extension, has an extension deficit, the likelihood that you need to get the joint swelling down is very high, but you might need to splint the finger to ensure the finger will actually go straight again. So those are some of the easy passive tests that you can do on your own. Consequences: if not treated, you might get a flexion contracture of the finger. So if you have that extension deficit, you can't get the finger to go straight, it might be hard to get the finger to go straight. That's not always a terrible outcome long term, but it's not desirable. So you want to catch these early to make sure that doesn't happen. You might get the chronic decreased range of motion and you might get some joint effusion. So joint effusion really just refers to fluid from within the joint spreading around into spaces that there's usually not fluid, by stretching the capsule, by spraining the capsule. So again, these come from a lot of aggressive pocket climbing. And then here's what one looks like. Here's what a volar plate one looks like on x-ray. So in this context, to give you some more visuals here, here's the tendons, right? And then the volar plate is a tissue that lives underneath the tendon where the A3 pulley attaches, which would be here. And so this would be a extension injury, the finger going into extension, putting a lot of stress on the volar plate. And what happens in this context is the volar plate chipped away from the bone, from the middle phalanx. So that's the fracture right there. That's one on this side, but they can also happen on the side and on the DIP joint. So it's not exclusively a PIP joint injury, but the PIP joint is the more common location for a capsular injury. And typically it will present like this: swelling, bruising, discoloration. Pulley injuries won't really do that. Tenosynovitis won't do that. Injuries to the bones will do that. Injuries to the blood vessels will also do that. So those are a couple things to look out for before booking a consult if you have an audible pop, grabbing a pocket on a finger.